Good afternoon again, everyone. My name is Stephen Listison, and I'm an Assistant Health Policy Analyst at the Health Policy Institute of Ohio. Thank you for joining us today for our webinar, Connections Between Criminal Justice and Health. The mission of HPIO is to provide independent and nonpartisan analysis needed to create evidence-informed state health policy that improves health value. I want to take a moment to thank our core funders who advance our mission with their generous support of our work. Their names and logos are shown here. We encourage you to tweet throughout today's webinar. You're also welcome to engage and connect with us on LinkedIn. We love engaging with you all and would love to continue the conversation on those platforms. So you can use the hashtags and @ on the screen. If you have questions for our presenter, please type them into the question box, or you can ask them later during the Q&A session after the presentation. Today's presentation slides and other related resources will be available on the HPIO website after the webinar. You'll find those by clicking on the Events tab on our website. This afternoon, my colleague Haley Aka will share information from our latest publication, Connections Between Criminal Justice and Health. After her presentation, we will have an audience Q&A session where you can type questions into the chat box on Zoom. And we'll end today's webinar with some information about what you can do to move this work forward. Haley Aka is a senior health policy analyst at HPIO, and she leads our criminal justice and addiction work here at the Institute. Haley holds a law degree and a master's degree in public policy from The Ohio State University. And with that, I'm going to pass it over to you, Haley.
Thanks, Stephen, and thanks to all of you for joining us this morning. I am Haley Aka. If we haven't met before, I'm happy that you're here. We're going to talk through the key findings of our latest brief on the connections between criminal justice and health this afternoon. Feel free as we move to type questions into the chat box. We'll get to those at the end of the session today. And I also want to, in addition to Stephen's lovely thanks of our core funders, I want to acknowledge Interact for Health and the Ohio State Bar Foundation that provided funds particularly for this project. We're so thankful for their support and contribution. So this pie graph may be familiar to you. It describes the modifiable factors that influence our health. And when we think about improving our personal health, a lot of us think about our health behaviors, how we eat, how we move, how we treat our bodies. And this is an important piece of the puzzle. We see that in the bottom left of this pie, that our health behaviors amount to about 30% of our health outcomes. But there are other factors that impact our health as well. Clinical care, like the access that we have to our healthcare system and the quality of care that we receive there, impacts our health about 20%. And then on the right of this pie in dark blue, you see that 50% of that influence on our health comes from our social, economic, and physical environments. These are the conditions of our communities, our housing, transportation, educational and employment opportunities, and it also includes any experience we might have with the criminal justice system. So in order to improve health, we need to pay attention to all of these factors, including the communities that we live in and the policies, systems, and structures that give people a fair chance at a healthy life. The same is true in the criminal justice system. Individual choices lead to community justice involvement, that's true. And the health and the conditions of our communities influence those choices. So we're going to explore those connections between health, criminal justice involvement, and community conditions today. And we'll do that using this framework. This is a visual representation of those connections between health and criminal justice, which include racism and community conditions as foundational factors that impact both experiences. We're going to take sort of a quick high-level view at a lot of these connections today. These are the high-level findings from the brief and a good outline of the topics that we'll be discussing today. First, there's a two-way relationship between criminal justice and health. Second, racism and community conditions contribute to both criminal justice involvement and poor health. And then finally, there are evidence-based policy solutions to combat the drivers of criminal justice involvement and poor health outcomes. And we're going to dive into each of these further this afternoon. Before we do that, let's start with some context on the criminal justice system. When we say criminal justice system, we're referring to the combination of law enforcement, courts, and corrections. And strongly held values of this system include things like community safety and ensuring justice for victims of crime. However, criminal justice policies have not always been in line with these values. And in fact, some foundational criminal justice policies disproportionately and negatively impact the health, safety, and well-being of justice-involved people, their families, and the broader community. And we're going to look at some examples of those policies today. The reach of the criminal justice system in the United States is incredibly large, and it's increased rapidly over the past several decades. This is a direct result of policy choices. Beginning in the 1960s, we saw a series of tough-on-crime policies expand the reach of the criminal justice system across our country and in Ohio, which resulted in the incarceration of tens of thousands of Ohioans and the increase in incarceration that we see here. This expansion of the criminal justice system is often referred to as mass incarceration. The US has the highest incarceration rate in the world, and Ohio has a higher incarceration rate than most other states. In 2019, Ohio ranked 39th in adult imprisonment, with 430 adults per 100,000 serving sentences in state or federal prisons. The expansion of the criminal justice system and this tough-on-crime approach to policymaking has been a bipartisan effort that's existed for the last several decades. Some of the policies that have led to this expansion include these things you see on the slide: drug control policies and other policies, penalties related to drug possession and use. These things are often referred to as the war on drugs. There's also the money bail system, which requires criminal defendants to be held in jail before trial unless they can pay a set price to be released. And then third, there's charges brought by prosecutors who have broad discretion in whether they charge a person who's been arrested with one or more crimes. And there's been a significant increase in charges brought by prosecutors in recent years. And these policies have been promoted as ways to deter crime and improve community safety. What they do is increase incarceration. And while jail and prison sentences do prevent incarcerated people from committing crimes while they're incarcerated, we know that the threat of incarceration does not prevent crime, and that having been incarcerated does not prevent future crime. So instead of contributing to community safety in a meaningful way, what mass incarceration has done is lead to the permanent disenfranchisement of many Ohioans, particularly people of color, people with low incomes, and people with mental health and substance use disorders. With that background, let's look at some of the ways that health impacts criminal justice involvement. Back at our framework, we're on the left side in light blue, which tells us that health, including substance use and mental health, can impact criminal justice outcomes like arrest, incarceration, and collateral sanctions. Many people who are incarcerated are also struggling with substance use disorder. Compared to the 5% of people in the general population who have SUD, more than half of adults incarcerated in state prisons and almost 2/3 of people who are in jail have substance use disorder. And that's in part due to the increase in drug-related arrests that we've seen over the past several decades. We see a similar story for individuals struggling with mental illness. 37% of people incarcerated in prisons and 44% of people in jails have a history of mental health problems. And the most common of these mental health problems is depression. In comparison, 20% of people in the general population have a history of depression. And although we see this disparity in incarceration for people with mental health conditions, there is nothing to suggest that people with a mental health diagnosis are more likely to engage in crime than people without a diagnosis. So one way we see people struggling with mental health and substance use disorder entering the criminal justice system is through behavioral health crises. Examples of behavioral health crises include things like drug overdose, impulsive or reckless action due to mental illness, or suicidal ideation or attempted suicide. And in these situations, first responders are often called, including law enforcement officers. And because law enforcement officers may not be trained in crisis de-escalation or equipped to respond to these very serious health conditions, interactions with law enforcement can lead to the arrest and the incarceration of the person in crisis. This is unfortunate because prisons and jails are not the best settings for behavioral health treatment, which is what that person needs. Substance use and mental health conditions are much more effectively treated in community-based settings. But because we have a lack of adequate community-based treatment options or availability, criminal justice settings have become a sort of de facto behavioral health treatment setting for many people. Ohio has invested in quite a few strategies to reduce the number of people with behavioral health conditions who are in prisons and jails. An example of this is our treatment court system. We have drug and mental health and other sorts of treatment courts in our state. These are evidence-based court programs that work with offenders to complete treatment instead of a prison or a jail sentence. However, there are some barriers to who gets access to these treatment court programs, and people of color are less likely to be enrolled. So here in the pie chart, we see that only 17% of treatment court participants are Black. And this is true even though Black Ohioans make up 45% of our state prison population. So now we're going to look at how criminal justice involvement impacts our health. This is the dark blue half of our framework, which tells us that involvement in the criminal justice system can impact our health outcomes, infectious disease, chronic disease, and mental health and addiction. Here are some of the conditions and diseases that can be caused or made worse by criminal justice involvement. It's certainly not an exhaustive list. I'll highlight a couple of examples. So chronic diseases like hypertension and asthma can be exacerbated by poor conditions in prisons and jails, like exposure to contaminants, mold, things like that, inadequate nutrition. And then behavioral health conditions like depression can be caused or triggered by incarceration, experiences of violence that occur inside prisons and jails, and then solitary confinement or other disciplinary practices can lead to these conditions. Overcrowding, lack of sanitation, other conditions of incarceration can also lead to the spread of infectious disease like HIV, hepatitis C, or COVID-19. And we saw that in the early months of the pandemic, when more than 80% of people incarcerated at Marion Correctional Institute here in Ohio tested positive for COVID-19 in the first few weeks of the pandemic by late April of 2020. Some of the policies that we identified earlier as contributing to mass incarceration are also detrimental to health. So for instance, drug sentencing laws. Those can include longer sentences for drug possession, which can lead to longer periods of incarceration for people with substance use disorder. And that can limit addiction treatment options for those individuals. It can also create barriers to recovery once they're released. The money bail system results in people being held in jail pre-trial when they can't afford to pay to be released. And that exposes people who've not yet been convicted of a crime to those negative health consequences of incarceration that we discussed. And then finally, there's limited access to pretrial diversion programs. These programs, like the drug treatment courts we looked at recently, They allow criminal defendants to enter community corrections or addiction treatment instead of being sentenced to prison or jail. However, people charged with violent or felony offenses, other types of offenses, don't always have access to these programs, regardless of their behavioral health treatment needs. Finally, major barriers to healthcare also exist inside prisons and jail. And that can be counterintuitive because it's true that state and local jurisdictions are required to provide incarcerated people with healthcare. And because there are barriers to healthcare access in the community, some people may experience better access to care when they're incarcerated. However, in our conversations with individuals who have experience of the criminal justice system and through our research, we found that many people who are incarcerated do lack basic and necessary services, which include things like access to their medication and treatment for substance use disorder. So for example, one study found that for incarcerated people with persistent medical problems, 20% in state prisons and 68% in local jails did not receive a medical examination. So finally, we're going to look at some factors in the community that lead to both criminal justice involvement and poor health. On our framework, we've reached the orange and the gray sections, which include racism and our community conditions, things like income, housing, and exposure to trauma, which are fundamental drivers of criminal justice and health outcomes. So first, we'll look at racism, which is the primary driver of disparities and inequities for people of color across all systems and sectors, including criminal justice and health. Racism manifests across all levels of society. Internalized and interpersonal racism occur within and between individual people, while institutional and structural racism are perpetuated by organizations and across systems, regardless of the intent of individual people. And while most conversations on racism focus on that individual level, each of these levels has an impact on the poor criminal justice and health outcomes faced by communities of color. So look at a couple of quick examples. Here on the left side of your screen, you'll see that compared to white children, parents of Black children are 17 times more likely to report that their child was treated unfairly due to their race. And this means that 1 in 10 Black children in Ohio are being treated unfairly due to race. On the right side, we see that those experiences of racism directly impact health and can have longer term consequences. So here we see that Black adults in Ohio are 5.5 times more likely to report physical or emotional symptoms as a result of treatment due to race. And that contributes to the many disparities in health outcomes for Ohioans of color that we see, including disparities in hypertension, diabetes, asthma, and depression. There are also large disparities in incarceration by race. Nationally and in Ohio, Black Americans are incarcerated in state prisons at more than 5 times the rate of white Americans. And Black Ohioans are also arrested at over 3 times the rate of white Ohioans. That was true in 2019, and you can see that that disparity has existed for a long time. So these are examples of systemic racism. The reasons for these disparities are not due to racial or ethnic differences in behavior. They are historic, systemic, and were intentionally created through policy. After the Civil War, slavery was replaced with a system of Black codes. These are laws that restrict the labor and activity of Black Americans. And once Black men in particular were incarcerated for violating those Black codes, they were leased out to plantations and factories as free labor in a practice called convict leasing. And in this way, slavery was reinforced and reimagined through the criminal justice system. And Black people and other people of color have been unduly burdened and targeted by the American criminal justice system ever since. Contemporary criminal justice policies like drug control policies and the money bail system continue to disproportionately incarcerate Black people and other racial and ethnic minorities, as well as low-income people of all races. That brings us to our next driver, which is income, employment, and education, drivers of both criminal justice and health outcomes. We know that poor economic conditions can lead to poor health. Here we see that Ohioans with very low incomes were more likely than Ohioans with higher incomes to report diabetes, depression, and current cigarette smoking in 2019. People with low incomes are also at higher risk for incarceration. So research finds that before they were incarcerated, the median income for justice-involved people is about 41% lower than the median income for other Americans of similar ages. And people who were formerly incarcerated also were nearly twice as likely to have no high school diploma or credential. And this connection between education and incarceration starts early in life in a process that's often referred to as the school to prison pipeline. These are punitive practices that happen in K-12 schools, like zero tolerance policies that lead many young people, particularly Black males and children with cognitive disabilities, out of school and into the juvenile detention system and eventually the criminal justice system. Not only are people with low incomes more likely to face incarceration, but incarceration then limits economic opportunities once they re-enter community. That's because of collateral sanctions, these legal restrictions on the rights, benefits, and opportunities of people who have been charged or convicted of crimes. These restrictions can limit a person's ability to work, get a degree, find housing, and participate in civic life. The most recently available data tell us that only 2 states in Ohio have more collateral sanctions, or only 2 states in the nation have more collateral sanctions than Ohio. And the majority of the collateral sanctions placed on Ohioans limit economic opportunity and employment. We know some policymaking has happened in this area since 2018, and that may have shifted. Another driver of both poor health and criminal justice involvement is exposure to trauma and the impact of trauma on families. ACEs are traumatic events that occur in childhood. You see examples here, things like abuse, household challenges, and neglect. Several of these things are directly related to criminal justice involvement of a parent. And experiences of adversity as a child can have both immediate and long-term negative health impacts, things like depression, learning disabilities, ADHD, and anxiety. Involvement in the criminal justice system is also traumatic for individuals and their families. Things like negative encounters with law enforcement, separation from family and community, solitary confinement, and other disciplinary practices are traumatic experience for justice-involved people. Not only that, but incarceration of a parent then destabilizes families and exposes children to trauma, which then increases the likelihood that the next generation will be incarcerated in the future. The final driver we'll look at this afternoon is housing and homelessness. Lack of well-maintained and affordable housing leads to poor health conditions like asthma after exposure to mold, or anxiety after experiencing the toxic stress of trying to make ends meet. High housing costs also make it more difficult for families to pay for other necessities like food and medical care, which are necessary for a healthy life. Not only that, but people with stable housing also commit fewer criminal offenses. In fact, homelessness is a significant predictor of nonviolent crime. And because of the wide-ranging harmful effects of lead exposure on behavioral health, children with lead poisoning from poor quality housing are 6 times more likely to be involved in the juvenile justice system. The connections between housing and the criminal justice system are even more salient for people experiencing homelessness. There are many state and local laws that criminalize homelessness, laws like loitering, begging, bans on laying down and sleeping in public. And these policies lead to the arrest and incarceration of people experiencing homelessness, which further perpetuate poor health and well-being for those individuals. So as we've seen, there are many challenges at the intersection of criminal justice and health. We have an uphill battle to climb, but the good news is that improvement is possible. There are evidence-informed policy options that state policymakers and other stakeholders can act on to improve outcomes and advance equity in criminal justice and health. And there are several ways that we can do that. We can support mental well-being and improve crisis response. We can reduce the number of people incarcerated in Ohio, improve health for people who are currently or formerly incarcerated, and then improve community conditions, particularly for those folks who are at highest risk of criminal justice involvement. A couple of quick strategies. One is for improving crisis response. To do this, we could dispatch medical professionals to behavioral health crises instead of dispatching law enforcement. This is the CAHOOTS model out of Oregon, and it could be replicated in Ohio. To reduce the number of people incarcerated in our state, we can increase access to treatment courts and pretrial diversion programs for criminal defendants who have substance use and mental health disorders. We have strong diversion programs in Ohio, and we can open those up so that more people have access and can utilize these programs. And then finally, to ensure that people who have served their time can reintegrate back into community, it's important that state policymakers reduce the legal barriers that prevent people with criminal records from getting jobs. So policymakers can eliminate excessive collateral sanctions and offer job training supports for each person exiting the prison system. So as we've seen throughout today's presentation, there are certain groups of Ohioans who are disproportionately incarcerated and negatively impacted by the criminal justice system. Policy options to reduce incarceration and improve health should be targeted and tailored to address the needs of these folks: Black Ohioans and other people of color, people with low incomes, people with behavioral health or disabling conditions, and people who are formerly incarcerated. And with that, I'll leave you with the high-level key findings from our brief, and then check in with Stephen to see what questions we have.
Thanks, Haley. Yeah, so if any of our attendees have questions for Haley, please type them into the Q&A box in your toolbar. We will have time for a few questions. I'm seeing one here from Meredith, and she asked how we can lower racial disparities in treatment courts.
That's a great question, Meredith. And it's something that needs, I think, a bit more examination. And I know a couple of people in the state who are focused on this issue and are trying to get to the bottom of why we see that disparity. I think one thought out there is that the requirements for being eligible for treatment court are being applied in sort of a neutral way, the same to everyone, but people who have felony offenses tend to be in certain groups versus others. So those restrictions on who has access to treatment court might look neutral, but are being applied in a way that results in that disparity. But that's just one thought on why that might be true. And I know more research is going into that, and will result in some options for how to correct that disparity.
Great. We have another question from an attendee that asks if we have additional work planned.
Great question. And yes, we do. So here this fall or later this summer, we'll be producing our next piece in the series, which is going to be sort of a closer look, a smaller piece focused on racism, particularly in the criminal justice system, and how that leads to negative impacts on health. So we're doing that. And then we're looking forward to future work where we can kind of narrow in on specific sections of the criminal justice system, things like pretrial and bail or reentry, and sort of dive deeper on some particular health issues that occur in those places.
Awesome. The last question I think we'll have time to address. Shannon Fisher asked if we're sharing the recording. Yes, it will be posted on our website and to the HPIO YouTube channel. And we'd love if you shared that widely with your networks if you found the information informative or particularly interesting. So as a reminder, I think that's a great time to say that today's presentation slides and other related resources like the recording will be available on the HPIO website and can be found by clicking on the events tab. We have a final poll question, or we actually have one of two. So it's on your screen now. How would you rate the quality of this webinar? great.
Haley, can you move us along?
We like to end our webinars and other presentations with ways that our attendees can influence the policymaking process. I know this is kind of a weird field for some to navigate if you're not directly involved in policymaking, but there are a number of ways that we can all influence public policy, such as providing analysis of a bill, writing letters, emails, or making phone calls, and organizing community partners to visit key policymakers, among other ways to influence policy. We have one last poll question. And this poll question asks how likely you are to use the information presented today to influence the policymaking process. So this includes using information to educate legislators or other policymakers, influence state agency priorities, make policy recommendations, lobby for specific information, or conduct other advocacy activities or efforts to shape policy agendas. Great. You can download the complete Connections Between Criminal Justice and Health policy brief at our website, and the link is shown on the screen. You can connect with HPIO on social media like Twitter and LinkedIn, as I discussed earlier, and we'd like to thank you all for attending our webinar today. Have a great rest of your afternoon.